if I'm a health system and I'm managing hundreds and thousands of patients, all I can think of, it would be really difficult to do this with individual platforms based on specialty. And to me, it would be beneficial to be able to cohesively manage my patients, whether it's diabetes care management, RPM, CCM, behavioral health, medication management, all these programs in one. Can you speak to how that would work for health systems? Do you do that for health systems?
Yeah, yeah, and there's a lot of benefits, right, to having RevCare for your practice if you're in a big healthcare system. So as we know, healthcare systems can be very large. One of the bigger benefits that can be very appealing is MG Revolution offers an additional clinical team onto your staff. So that healthcare system can utilize our specially trained clinical team to view their patients' care and keep an eye on their patients, monitor their values, and only send critical alerts or action needed that is going to be required from the healthcare system. So we're taking off the workload or ensuring that we're not adding any workload to that healthcare system. In addition to that, we can monitor multiple things, especially if we're staying on the topic of CGM and RPM, if we're monitoring patient values and doing that in between care. So typically I kind of explain it. We are the care in between patients' office visits, right? So we are monitoring those values. We can talk to the patient anytime, give them a call, but essentially with CCM, connect with them at least once a month. RPM, review their values in real time, making sure they're maintaining within that threshold. And again, that threshold can be anything that healthcare system wants to set, either at a practice level or at a patient level. So it can be very detailed and patient-specific care that we are providing. And then we rely or lean on that healthcare system or those providers if that care falls out of those thresholds, if that patient is having critical signs and symptoms, if that patient is constantly above threshold for multiple readings in a row, and we do triage. Based on our triage results, we're going to alert that provider and say, hey, this patient needs to get in for an appointment. Hey, you might need to change this patient's medications, etc. So for healthcare systems, we really are an extra layer of support that is doing a lot of care for your patients, that is allowing us to take some workload from you perhaps and not piling on extra work to be the eyes and ears for that patient in between the times that they're seeing their provider.
Wow, that's a nice benefit, especially, with more information comes really, what do I do with it? More interpretation, more.
Right.
So you're kind of this level one support that clinicians can rely on to keep an eye on patients with this real-time data, but then intervene with them when it's necessary and not for every single call. Because I can imagine it can be overwhelming and it's really hard to get into my doctor for sure, let alone a callback, right, from my nurse practitioner. So I would assume that that's a real benefit for clinicians.
For sure.